but there's also a lot of data integrity issues, meaning when you look at a number, it's not always the actual number that you should be looking at. Tons of numbers, right? We have numbers coming out of the ears in the dental space, but there's also a lot of data integrity issues, meaning when you look at a number, it's not always the actual number that you should be looking at, right? It's a little more complicated, right? Even if you just look at accounting, if you're doing cash basis or accrual, right? And it's like you end up in these totally different places by looking at the numbers through two different ways. How does Kasper help with that, or how are you guys tackling that problem?
So we're really anti information overload, and we say that really carefully because we don't want to be known as a platform that has 400 different reports, because we say, hey, that this justifies our fee.
You mean
And
you don't want to be like a company that has so much information that you have to hire another company to sort through the
exactly,
information? Okay, got it.
exactly. And we say that in the nicest and the most respectful way possible.
Yeah.
You know, so we want to give you, like I said, things that actually matter. You know, as a business owner, there's always things that can be fixed. There's always places on where you can improve. But at the end of the day, there are core things that are priorities. So for example, if I have 3 cancellations today, that is the priority, is that for me to fill in these 3 canceled appointments
Yeah,
today.
because you're never
All
going to
of
get
these
that
other
back. Yeah.
hypothetical things,
Yeah.
sure, we need to give the team right now a solution, so that they can fill the doctor's schedule for today. So we prioritize it based on that. Is that, you know, what can we do today to help you get an ROI today? What can we do at the end of the week? What can we do at the end of the month? What can we do every quarter? What can we do at the end of the year? But it's a plan. There's a strategy. There's a clear roadmap. Hey, doc, this is how we're going to help you today, next week, next month, this quarter, these first 6 months, this year. So then when you're doing your year over year review, I helped you get better in baby steps. It wasn't just an overwhelming, here's 400 reports, hey, go figure it out.
Mm.
And then you're just sitting there scratching your head, and you still have all this other crap that goes on in the office, and it's overwhelming, you know?
Yeah.